All right, so format for today, each program will present on their topic, and then we will do questions at the end of the webinar. We're going to be starting today with some information about our community health assessment. We will pause for a question and answer portion for this first topic, and then we will go through the rest of our programs, including sexual health and immunizations, care coordination services, health insurance literacy, women, infants, and children, nurse-family partnership, safe care, our regional oral health program, thriving communities, and cancer prevention and early detection. So with that, I'm going to hand it off to Adrian.
Thanks, Katie. So I'm Adrian Uzuni. I'm the Director of Public Health Innovation at San Juan Basin Public Health. So I'm going to give a brief overview of the Community Health Assessment and the Public Health Improvement Plan. It's an important community participation survey. It's a process that we go through every 5 years, an important public health tool that creates a shared understanding of what healthy community is. And it's especially important this time around just because both counties are creating new public health departments starting in 2024. So first, briefly, just assessment and planning. It's one of the central capabilities that every local public health agency in the state of Colorado needs to have to deliver high quality public health to the people of Colorado. So all local public health agencies have to monitor, diagnose, and investigate public health problems and hazards, which includes collecting, analyzing, and reporting data. So one of the core activities within that is completing that community health assessment and public health improvement plan every 5 years. Next slide. So the overview of the 2023 community health assessment. So all local agencies have the flexibility to create an assessment that works best for the populations that they serve. So at San Juan Basin Public Health, we're committed to a really robust process that represents the diversity of populations in Archuleta and La Plata County. So this time around, and you've probably already seen several notifications about this survey being live. We're having a survey available to Archuleta and La Plata County residents. The first question asks you to indicate what county you live in. It's going to be open through the first week of April. There are 18 questions, about 18 questions on community health, and there's English and Spanish translations available. A lot of people contribute to the community health assessment report, including advisory committee of community leaders from both counties, several departments within San Juan Basin Public Health, and we're also having support from Fort Liz College students, as well as a partnership with the Colorado School of Public Health to complete the assessment. Next slide. So with this presentation, I just have two asks. One is to please take the survey, and that QR code will take you to the survey on your phone if you hold up your camera to it. Again, your voice as a resident's really, really important. It informs the direction of public health for the next 5 years. But we've also heard that the report is used by local agencies to support program design, as well as grant writing projects that they work on to support their agency functions. Next slide. And second is you'll see the survey being promoted on our website, social media, newsletters, outreach events, and presentations over the next couple of months. So we're also asking you to please promote the survey. We really want every resident in both counties to have their voice heard, especially during this time of both counties forming their own health departments. Next slide. And this is just to give you an idea of what the public health improvement plan could look like once the data collection process is done. So this is the current public health improvement plan for San Juan Basin Public Health that is in effect through the end of 2023. It takes into consideration our legal requirements as a local public health agency, what the community thinks is important, which is the community health assessment, what secondary data tells us is important, and then what our staff thinks is important to prepare for the next 5 years. So this is just, again, an idea of what the next public health improvement plan could look like that would be in effect from 2024 through 2028. Next slide. This really high level timeline. So the takeaway from this is just the community health assessment survey is again open through the first week of April. Planning to have a community health assessment report published by the end of May, and then a public health improvement plan done and submitted, accepted by the local boards of health by the end of 2023. And that's all I have. That QR code, again, will take you to the survey. I think there are documents submitted in the, or links submitted in the chat too, to take you to the survey. I think Katie said we'll have questions right now for the community health assessment if there are any.
Great, thanks, Adrian. So if you have any questions regarding our community health survey, feel free to drop those into the chat now. Adrian, while we're waiting, I know the answer to this, but just for our participants, who do you want to fill out this survey?
So anyone who is a resident of La Plata and Archuleta County is who we want to fill out the survey. So the more survey responses that we get, the better.
Great, thank you. All right, I am not seeing any other questions come in. So if questions do come up, please feel free to drop those in the chat. And in the meantime, we will keep going. So next up, we have Audrey McCabe with our Sexual Health and Immunization Clinic.
Hi, everyone. My name is Audrey. I'm the clinic coordinator and medical biller for San Juan Basin Public Health, and I'll be talking to you about our Sexual Health and Immunization Clinic. Next slide. So our immunization clinic provides all recommended vaccines by the Advisory Committee on Immunization Practices. The goal of this program is to ensure that all Coloradans have access to vaccines and cost not to be the barrier for being up to date on those vaccines. The vaccines for children, otherwise known as VSC. We provide vaccines to uninsured and underinsured children, including those with Medicaid. So some vaccines are required to enter schools in Colorado, while others are recommended. We encourage patients to have vaccines at their primary care doctors, but as needed, we could fill in those gaps to receiving care, especially those not having insurance coverage, and there's no cost to the patients. The vaccines for uninsured adults, otherwise known as 317, it's similar to the VSC program, just providing vaccines at no cost to the patients for uninsured adults. We do ask patients to pay for $21 for the administration fee just to continue these programs so we can still offer those vaccines, but the fee can generally be waived or reduced. We also provide travel consults and vaccines for those who are going out of the country, and we provide COVID vaccines for those who are 6 months and older. Next slide. So our sexual health clinic, we provide testing at low cost with free testing for chlamydia, gonorrhea, syphilis, HIV, and Hep C. We generally go through like a visit fee cost, which normally starts around $70. We also have treatment for all STIs. Other providers in our area do refer to us for expertise, and we also provide access to specific treatments that are not available at other locations. We also carry Plan B, and we do walk-in pregnancy tests as well at our office. Next slide. With our sexual health clinic, we've been able to do some HIV outreach testing available throughout the community. This helps increase access. It gains relationship with some populations that might be less likely to come to the clinic. It's been very successful and to be able to build those connections with our community members. Next slide. We provide PrEP to our patients who are at risk for HIV transmission. There are gaps in accessing the service at other primary care providers. So our clinic provides this medication to our patients. PHIP is like an insurance through Colorado that covers PrEP care. So things like office visits, medications, vaccines, tests. It's a really great program, and we're really happy that we can get people started with this pre-exposure prophylaxis for HIV. Next slide. I won't go into too much detail about the Women's Wellness Connection program, as it's another presentation that you'll be hearing from us. But we do provide well woman checkups in the clinic. It's free to people who qualify. As of last July, we were able to provide these services to people who are not lawfully present, which was a big gap. So we're very happy. This program provides like free PAPs, HPV tests, breast screenings, and mammograms. It can also cover diagnostic testing like colpos, diagnostic imaging, and biopsies. Next slide. We have the opioid risk reduction program, and through this, we've been able to distribute naloxone, which is an opioid overdose reversal medication, also known as the brand name Narcan. It comes as a nasal spray or an injectable medication. It can be administered by the person. And we have fentanyl test strips that can test a diluted drug to check for fentanyl if it's present in that drug. We have been able to go out to the community and distribute this. If you all are free, February 8th from 11 to 3 at our Durango office. You all are welcome to come by and learn more about this and get trained on to help save a life. Next slide. So through each of these programs, we found the gaps to increase access for uninsured adults and adolescents requesting confidential care. And we offer prevention tools that are not easily accessible or where cost is a barrier. So we're very happy. If you all have any questions, you can go and contact my manager, Ashley Gonzalez. Thank you so much, and have a good day.
Wonderful. Thank you so much, Audrey. And as a reminder, if you have any questions for Audrey, you can feel free to drop those into the chat, and we will get to those at the end. Next, we have Karen Malatich with our care coordination services. Excuse me.
Hi, everyone. Can you hear me?
Yes, we can, Karen.
Okay, sorry. My name is Karen Malatich, and I'm the MCH Nurse Care Coordinator under Care Coordination Services. And this is our team. Tiffany Roberts is the program manager, and Kalisha Crossland is the division director for community health programs. So MCH stands for Maternal Child Health, and it's just a broad category of public health whose mission is to optimize the health and well-being of mothers and children throughout Colorado. And in order to do this, MCH mostly works through local public health agencies with prevention and early intervention strategies. And then HCP is a program under MCH. HCP is provides support for children and youth with special health care needs, and it connects families to resources, again, provides care coordination, and improves access to pediatric specialty care. So I, as the care coordinator, work with families to identify and prioritize needs, whatever the family feels is most important. And this can include multiple things, finding services and support, access to care, which can be challenging in the area we live in. There's no pediatric specialist here, so people either have to go out of the area or use telehealth, which fortunately has increased over the last couple of years. Also, a lot of these kids have multiple providers on their team. It can be primary care specialists, therapists, physical, occupational therapy, as well as behavioral health therapists. Sometimes schools are involved, so I can help communicate across all these different providers to make sure everyone's on the same page and communicating. And then, also connect people to resources. I know a lot of our community partners do these things as well, but refer people for pretty much anything from food, housing, transportation, help with durable medical equipment or things that insurance doesn't cover. I also do home visits, so I can meet people at their homes if that's easiest for them, help fill out applications, pretty much anything that's going to support the family and help them provide the best care for their children. So who does HCP serve? We serve children and youth from birth to 21 years old who are at risk of physical, developmental, emotional, or behavioral conditions. And generally, special health care or special needs just means that the child requires more intervention than what is typical for their age group or their peers. And our program serves La Plata and Archuleta counties, though we're not restricted to that area. So if there's someone in San Juan or Montezuma County that needs assistance, we're happy to help. And then we're really dependent on referrals from our community partners who work with these kids and families. We also get referrals internally from our other programs such as WIC, Safe Care, and Nurse Family Partnership. And parents and caregivers can contact us directly as well. And then I do want to note all of the care coordination that I provide for children and youth with special healthcare needs. I also provide for anyone else. So the general public, it can be individuals, children without special healthcare needs. I work a lot with seniors. So anyone can be referred for these services. And the best way to make a referral is just to call me or send a secure email. You can fax, and you can also give my information out to the families to call me directly. And we will be providing all of our contact information in one document. Thank you.
Karen. Yes, we will share slides and a sheet of contacts at the end of the presentation. Next up, we have Emma Tomlinson with our Health Insurance Literacy Program.
Thanks, Katie. So I'm Emma Tomlinson. I'm the health coverage guide in our health insurance literacy program at San Juan Basin Public Health. Karen Miletich, who just made a presentation, is also our additional health coverage guide, and our program is within the community health division. So in the health insurance literacy program, we help community members find affordable health insurance, whether it's with Colorado Medicaid or with Connect for Health Colorado. We also provide health insurance literacy, so understanding the coverage that we find for our community members. We currently serve Archuleta, La Plata, and San Juan counties. The three primary programs that we work with, which I kind of mentioned before, is Connect for Health Colorado, where you can receive tax credits to help lower monthly premiums or lower the costs of your health insurance. Colorado Connect, where Coloradans who are undocumented can actually shop for health insurance. And Health First Colorado, otherwise known as Colorado Medicaid. So first, we'll talk about the eligibility requirements for Connect for Health Colorado. So if you're referring anyone to our program, just know that, of course, they have to be a resident of Colorado, a citizen or legally present, file taxes. If you're married, you have to file jointly, and you cannot be eligible for Medicaid or Medicare. So the income requirements, this kind of went up this past year, but for example, a household size of 1 can make up to $51,040 per year and still be eligible for tax credits to lower those monthly costs through Connect for Health Colorado. In order to apply for those tax credits and purchase health insurance through Connect for Health Colorado, you have to apply during open enrollment, which is November 1st through January 15th of every year, or during a special enrollment period, otherwise known as a life-changing event. So for example, if you recently lost your health insurance, you have 60 days to apply. If you just got married or you just had a baby or adopted a baby, you have an option to apply for health insurance through Connect for Health Colorado within 60 days. Next is Colorado Medicaid, which I'm sure you guys are all familiar with. You have to be a resident of Colorado, citizen or legally present under the age of 65, and of course meet the income limits. There's no enrollment periods at this time for Colorado Medicaid. You can apply anytime. These are the income limits for Medicaid at this time. It will change April of this year. It actually changes every April, tends to increase. But as you can see, a household size of 2 can make up to $2,029 and still be eligible for Medicaid. So coming up soon, we're getting ready for the end of continuous Medicaid. What that means is during the public health emergency, those who were currently on Medicaid and then found themselves over income or ineligible for Medicaid actually stayed on Medicaid. So even though they were ineligible, they stayed on Medicaid during the public health emergency. Just recently, they announced that they separated that from the public health emergency. And starting in April, Colorado is going to figure out how to make the transition for those who are on continuous Medicaid to transition off. So we're here to support any community members that are making that transition off of Medicaid. Also, for Connect for Health Colorado, the tax time enrollment period is coming up. So what that means is when you file your taxes, there's actually going to be a check box that you can check that says, are you interested in receiving tax credits to help lower your insurance? And it'll be sent over to the IRS. The IRS will say, oh, it looks like you are eligible for tax credits. This is great. So they'll open up a special enrollment period for those who are eligible and can actually purchase health insurance and get tax credits off of Connect for Health Colorado. Here's our contact information. We do accept referrals from anyone. So it doesn't matter if you're a community partner or not. If you're a community member, you can just give us a call and we can certainly help you. Again, this is to help not only with the application process, but also understanding your health coverage as well. Thank you so much.
Great, thank you so much, Emma. All right, next up we have Jenny Howell with our Women, Infants, and Children program, or WIC.
Hi, everyone. Thank you, Katie. Yes, my name is Jenny Howell. I am the program manager for the WIC program, Women, Infants, and Children, here at San Juan Basin Health. And I'm going to give an overview of the WIC program, including the eligibility requirements, the benefits of being on WIC, and how to enroll. Next slide, please. So there's the team. That's myself, the WIC manager. I'm also a registered dietitian and lactation counselor. And Inez Winter is based in Pagosa Springs. She's a WIC educator, also bilingual in Spanish, and takes care of all the Spanish speakers in our service area. Raylene Charlie is a WIC educator here in Durango with me, and she also is a certified lactation counselor. And Kalisha Crossland is our division director. So WIC, the WIC program supports women and their children during a critical time of growth and development through 4 core services. Information and education on healthy eating being one of them, breastfeeding support, referrals to other programs, such as some of the ones you've heard about so far today, health insurance, and the nurse, Karen's program, sorry, and also our NFP program that you're going to hear about, and many other programs in the community, as well as the 4th component of WIC is the food benefits that I'm going to get into a little bit more here. All of the WIC services and benefits are free to participants, and families can choose to go to any WIC clinic in the state of Colorado if they're enrolled in Colorado WIC. Next slide, please. So who receives the WIC services? Well, it's in our name. We serve pregnant women, breastfeeding women for a year after birth, postpartum women for 6 months after birth, babies and children up to their 5th birthday. Next slide. There is a common misconception that WIC is only for women. So that is true, but WIC is also for all kinds of families, married, single, moms, dads, grandparents, foster parents, working families, not working families. Anyone who's a caregiver of a child may apply for WIC for their children. One fact is that WIC serves over half of all the babies born in the United States. Next slide. In order to be eligible for WIC services, applicants must meet 3 criteria areas. The first one being the category. So that's the pregnant women, infants, and children. There is an income requirement, and I'm going to get into that in a little bit more detail at the next slide. And then last, must just live in the state of Colorado. Next slide. If a mom or a child is currently on any of the programs shown on this slide, so that would be Health First Colorado, Colorado's Medicaid program, food assistance known as SNAP, or cash assistance known as temporary assistance for needy families, or the food distribution program on Indian reservations, which we have one of those here in La Plata County in Ignacio. If a person is on any of those programs and meets the category criteria, makes them automatically eligible for WIC. Next slide, please. The other way a family can be eligible if they do not participate in those programs is that just by their income, and their income must be less than 185% of the US poverty income guidelines. And that cutoff is higher than the guidelines for Medicaid. So they can be over income for the Medicaid or the other programs and still qualify for WIC. This slide shows, for example, a household. It's based on household size. So a household of 4 could earn up to $988 weekly, or that would equal $4,279 per month, or about $51,000 per year. So if you remember the numbers on Karen's slide, on Emma's slide for Medicaid, the cutoff was lower. So we do serve families that are more mid-income as well as low income. Next slide, please. I'd just like to touch on the difference between WIC and SNAP. They're both food assistance programs with an acronym. People often get them confused. WIC is specifically for women, infants, and children, whereas SNAP can be for any, man, woman, child, adult. WIC is specific foods in the grocery stores are allowed to be purchased, whereas SNAP is almost any food. Nutrition education is a required component of WIC, but not required for SNAP. And WIC does provide individualized nutrition counseling and breastfeeding support. And that is not provided through SNAP, but they do have a program called Double Up Food Bucks that extends their dollars when they buy fruits and vegetables. WIC has been around for over 40 years and has been proven to improve health outcomes, and such as reducing premature births, reducing low birth weight babies, reducing anemia, and many more. We do that just by giving the support and education to the families so that they can have the tools to raise healthy families. It's also been proven to be a good return on investment. WIC is well known for the food benefit portion of the program. Our clients receive a debit card that's loaded with specific healthy foods. On average, it's about $80 to $100 worth of food per participant. That number is probably higher now because of the food costs have gone up recently. And that number does not include if the family is receiving infant formula, because those are quite expensive, and that would be in addition to that dollar amount. I wanted to share that the food list, the allowed foods that people can buy, is expanding starting March 1st of this year. There's been a lot of new additions, many more organic items, more options including canned fruits and vegetables, and more. So we're really excited that the food list once again has been expanded, and I think our clients are going to be pretty excited about it. So WIC is more than just free food. Our staff include registered dietitians and other paraprofessionals who are trained in nutrition education to provide, individualized counseling to meet the needs, whatever's going on in that family. Some topics we touch on are healthy eating during pregnancy, introducing baby foods, eating challenges with toddlers. So we really get into talking to whatever it is that's going on in that family to help them meet their health goals. So whether a mom is planning to breastfeed or still deciding, we're here to support her and offer her, information and support, and help her work through any concerns she might have about breastfeeding prenatally, and then we're here to support her after the baby's born. All WIC staff at San Juan Basin Health are certified lactation counselors. WIC also provides breast pumps free of charge. So as far as connecting families to WIC, I do want to mention that we serve Archuleta County, La Plata County, and San Juan County, Colorado. So that would be Silverton. So right now that is our service area. And anyone that wants to refer to WIC, the easiest way is to go to this coloradowicsignup.com, and it's a short intake form with name and contact information. And once that's submitted, it goes to our inboxes, and we reach out and contact that family and get them started with an initial appointment. Right now, we're doing all of our appointments by phone. So it's easier than ever to get enrolled in WIC. Thank you so much. I'll look forward to any questions later.
Great. Thank you so much, Jenny. Next up, we have Danette Jackson with the Nurse Family Partnership Program.
Good afternoon. I'm Danette Jackson with Nurse Family Partnership. I'm a program manager and a home visitor for the program. We are in the Community Health Programs Division at San Juan Basin Public Health. We serve first-time moms starting in pregnancy and continuing until the child turns 2 years old. We are in all the counties in Colorado, and as well as other states in the United States. And we are a home visitation program, but we can meet clients in other locations if that meets their needs better. And we can also do some telehealth visits if that works for the clients, such as days like today where it's snowing. So we have specially trained nurses in this NFP model, and the model is based on over 40 years research. It's intensive. Visits start during pregnancy and continue until age 2, with visits about twice a month. So they can be a little bit more than that or a little bit less than that, just kind of based on clients' needs and wishes. and it's timely. We know the time starting in pregnancy and until the child turns 2 years old is a really important time for the health of mom and baby, for the development of the child, as well as for family bonding. So nurse-family partnership, to be eligible, you need to be pregnant with the first child or have a first child that is younger than 1 month old. And a client is welcome to have other people present during our visits. It could be dad, a grandparent, or a friend. We have handouts for dads as well. Clients need to meet income eligibility and education eligibility. So we look at mom's income, and if she qualifies for WIC or Medicaid, she qualifies for NFP, but actually our income is a little bit above those programs. So she may qualify for our program, even though she's above WIC or Medicaid eligibility. And also living in Archuleta, La Plata, and San Juan counties in Colorado. So nurse-family partnership has 3 goals. One is to improve pregnancy outcomes. So we have information, handouts, and resources on topics such as nutrition, exercise, lowering stress, preparing for childbirth, preparing for breastfeeding, really any questions that come up during the pregnancy. The second goal is to improve child health and development. So anything related to being a parent, we can help with information and resources. Some topics may include baby proofing your home, could be child development, what to expect as a child grows, maybe changes in sleep or teething or toddler behavior, for example, how to prepare for that and what to do when it happens. As well as we have some developmental toys, different books in English, Spanish, and Navajo that can support activities between parents and child. Another goal is to improve economic self-sufficiency of the family. So if a mom is wanting to go back to work after the baby's born, or go back to school, or stay home with baby, just helping with resources that she may need to meet those goals. So how do we do this? Our moms receive care, information, and support from nurses specially trained in pregnancy, early development, and the unique NFP proven model of nursing care. So this is an example of one of our brochures. A lot's going to change, but you've got this with a free personal nurse who can give you the support, advice, and information you need as a new mom pregnant with your first baby. And so community partners or potential clients can contact us by calling us, texting us, or going on the San Juan Basin Public Health website under Nurse Family Partnership. There's a contact form that can be filled out, and then a nurse would reach out to a potential client that way as well. So this is a quote from one of our graduates. "The confidence I gained with working with NFP is immeasurable. The support and guidance offered through this program was so useful and helpful for my child and me. I would absolutely recommend this program to all first-time mothers." So this is our NFP team. Sandra is our admin assistant. Michelle and Tanya are our nurses, and myself. At Nurse Family Partnership, we believe better worlds start with great families, and great families start with us. Feel free to put any questions in the chat, and we can answer that after everybody else has presented. Thank you so much.
Great. Thank you so much, Jeanette. Next up, we have Tot with our Safe Care Colorado program.
Hello, I'm Tot. So yeah, I am the parent support provider with the Safe Care Colorado program. So we are a 2-person team. I work with my supervisor, Jen, and she also is a parent support provider. And we fall into the community health division that many of these other programs have mentioned as well. So what is Safe Care? We are a free, flexible, in-home parent support program. So that means we are in homes with our families, but we can meet families kind of wherever they're comfortable. We have families we meet at the library or when it's warm enough, not days like today, but we can meet families at the park or, wherever they're most comfortable. So this is for families, parents or caregivers, grandparents or aunts and uncles, or, whoever is taking care of the kiddo. And then we focus on prevention, parent-child interactions, health and safety of the children. And this is one-on-one training provided over about 4 to 6 months if the parents decide to do all 3 of our topics, but they don't have to commit to all 3. They can just decide to do 1 or 2 if they want to. So who's eligible? We work with families with children up to 5 years old, so through the age of 5. And then they must reside within the Southern Ute Tribe, La Plata, Archuleta, and San Juan counties. There's no requirement to be legally present, which is really great. They must meet certain high-risk eligibility. So that's things, those are things like being a single parent, being a young parent, multiple kids under 5. But that's things that we can talk about with our families when they get referred to us. But the thing that's great is there is no eligibility in terms of income or education. Some of the eligibility is, in regarding to having less than a high school education or being on public assistance, but that's as far as that goes. So then we are an evidence-based program. We have more than 30 years worth of studies behind us showing positive changes to parenting skills. We very much want to go based on starting with the skills our parents already have, but there's improvement with the health, safety, and parent-child interactions. And all of our families show that they have high satisfaction after engaging with all of our program or all of our topics. And then there's fewer subsequent substantiated reports to child welfare. A lot of our parents have decreased depression, especially with our mothers, which is really great. And there's a lot of benefits to a diverse population, which is really great since we have the tribe here. And then just a little bit of an overview. So like I mentioned, we have 3 areas of focus. We go over safety, health, and interactions with between the child and the parents or caregivers. And then we have gift card incentives for completing each topic, and we can provide materials for free within each topic. So yeah, again, this is a free program, and all of these materials are free. So first, in depth with home safety, that's all about understanding the importance of keeping your home safe for your little one. We help our families understand and identify hazards and how to make them or how to remove them, and then implementing ways to remove them. And then we can provide materials to make their house safer. So we can provide baby gates or outlet covers, things like that for their home. So then child health is all about prevention and then identifying and responding to illnesses and injuries. So determining the level of care. So staying home, going to the doctor or the emergency room, and then how to keep good health records and using our health manual that we provide. A lot of our families say that health manual has really reduced their anxiety related to their children's injuries and illnesses, and it was created by a pediatrician, so it has a lot of great information, and we can help provide some health related materials as needed as well. So those are things like thermometers, medicine dispensers, or first aid kits for the little ones. So then parent-child interactions is all about improving interactions between the caregiver and the child and engaging in age-appropriate activities, and then decreasing unwanted behaviors from your children and improving the behaviors you do want to see, and then recognize the developmental milestones. So then how it works, there's a couple different ways parents and caregivers can be referred to us. So community members, like all these different programs, and other community partners can refer to us. Child welfare can refer to us, or parents and caregivers can refer to themselves to us. So families or community partners can give us a call, you can email us, or on our website, you can also refer to us. So thank you, and you can ask questions in the chat.
Thank you so much, Todd. Next up, we have Tiffany Roberts presenting for our Regional Oral Health Specialist program.
Thanks, Katie. So I'm Tiffany. I'm the Senior Program Manager in our Community Health Division, and I'm presenting today on behalf of Courtney Justice, our Regional Oral Health Specialist. So this is our team. Again, we're in the Community Health Division, so work alongside so many of these awesome programs. So the Regional Oral Health Specialist program, or as we affectionately call it, the ROSE program, does serve 5 counties. So we serve La Plata, Archuleta, Montezuma, San Juan, and Dolores. We're funded through the Colorado Department of Public Health and Environment, and our focus is really working on improving access to oral health care, preventative services, routine and urgent services, and oral health education. And we really focus on serving vulnerable and underserved communities to help improve health outcomes. So a lot of times people ask, how do oral health and public health go hand in hand? And they're actually really, really interconnected. So first of all, dental disease is almost completely preventable. And in fact, caries or cavities in children is the leading cause of illness and disease in children in the US. So there's a lot of work to be done. Oral health and general health also go hand in hand. For example, people with poor oral health are more at risk for cardiovascular or heart disease. So in helping people have good oral health habits, we can actually impact a lot of other health outcomes and decrease the risk of chronic disease. And then, of course, socioeconomic factors do play into overall health outcomes. That's true in all of health, but it's also true specifically to oral health. So our work is also really deeply rooted in health equity and reducing health disparities. So this program has a lot of components and a lot of different moving parts. Perhaps one of the biggest one is our school-based oral health program. So for this, our dental hygienist, Courtney, actually goes into the schools and can do a bunch of different things. This includes just initial screenings in the mouth, teeth cleanings. She can place sealants and fluoride to help reduce the risk of tooth decay. She does a lot of preventative education, refers people to dental services if they have an urgent dental need, and then really works to connect children and families to a dental home so that they have regular routine access to high quality and affordable oral health care. So she does do these services throughout the 5-county region. I kind of touched on this one already, but another component of the program is dental navigation. So Courtney works really hard to keep an updated referral list and an understanding of all the different oral health care providers and resources in the area, and can connect community members to those services. She can help people navigate oral health care benefits, can advocate on behalf of members, and then is really just there to kind of guide the process to get people assistance with complex oral health care needs. So just trying to make navigating those needs and insurance and access a little easier for our community. Another component of the position is the Regional Oral Health Coalition. So for this, we convene oral health stakeholders. So this could be dentists, dental hygienists, dental assistants, or just community members who are interested in oral health. And we come together and try and identify and respond to gaps in services specific to oral health care. So examples could include workforce shortages, transportation issues, insurance reimbursement for transportation. So just kind of trying to identify different things that could be affecting people's access to high quality oral health care, and then trying to help troubleshoot and resolve those gaps, really with the focus on supporting access to care. And with another side benefit of really just building a strong dental community where we all know each other, can refer to one another, and really just, again, support the community's experience in engaging with oral health care providers. So last but not least, we do want to share a little bit about a new program we have coming up, which is the Tele-Oral Health Project. So this is a new project that we're working on rolling out. It's focused specifically on pregnant women and children aged 0 to 6. And the idea is that people could schedule a telehealth visit with our dental hygienist. She would do a risk assessment to learn more about, someone's oral health care habits, could do kind of a high level assessment of the mouth with pictures, or even just using the phone camera in the mouth to get an idea of what's going on in case there's any urgent referrals that need to happen. It's a great opportunity to do education and preventative services and information for young children, families, and pregnant women. And then again, really focusing on that referral to a dental home so that people can have regular access to high quality oral health care. We think this program can be really promising to reaching people in rural areas that might not have access to dental services at a regular basis, and is also just a great way to engage children in a really positive environment that's focused on fun and skill building so that they can develop really great oral health care habits for their lifetime. So if you have any questions, please feel free to drop them in the chat or share at the end of our presentations. This is our information for Courtney Justice. Again, she is our regional oral health specialist, so feel free to reach out to her. She loves talking about anything and everything to do with teeth. Thank you so much.
All right, moving into Thriving Communities programs. So I'm going to turn my camera off just after this first slide. But you'll still hear me. Very good. My name is Paige Wagner. I oversee upstream prevention grants known as Thriving Communities programs at San Juan Basin Public Health. Next slide. So for the sake of time, I'll be focusing on 3 of our programs that are focused on preventing youth substance use in La Plata County, tobacco use in La Plata and Archuleta, and deaths by suicide in La Plata County. Next slide. So this is our team, Dixie Reed, Amelia Majewski, and Anna Denali, who lead the coordination of the community efforts in our health district. I like to share this graphic to demonstrate different types of prevention. So you guys are all familiar with prevention. At the top is tertiary prevention, which is firmly intervening once you've already been diagnosed with a disease or engaging in a risk behavior. In the middle is secondary prevention, which is largely screening for a risk before it becomes a problem. And finally, at the bottom is primary prevention, which impacts the greatest number of people. All Thriving Communities programs focus on primary prevention. So this can include things like promoting healthy activities, positive communication styles, providing education and tools for building healthy relationships. A lot fits into primary prevention, and it doesn't all feel so obvious. Next slide. Yep. The first Thriving Communities program I'm going to highlight shows up in the form of a community-led coalition committed to reducing the rates of substance use in La Plata County youth, ages 12 to 24. This coalition is known as the Recognizing Opportunities Around Resilience Coalition, or ROAR for short, and was established in 2018. So this coalition has identified top risk factors in La Plata County as far as our contributing to youth substance use as 1, community laws and norms favorable towards substance use, and 2, favorable parental attitudes and involvement in substance use. So our strongest protective factor is opportunities and rewards for pro-social involvement. I actually think I'm hitting on the next slide here, but we basically use that 5-phase process that was on the last slide to establish these as our top risk and protective factors. Next up. So this is just some examples of ROAR in the community. We're currently working with the state and our coalition partners to build out action connected to those risk and protective factors. Really emphasizing the need for youth to lead the charge in deciding what's going to work best and what those projects need to be. So if you'd like to be involved, we'd really love to have you. Our tobacco use prevention work overlaps a lot with the ROAR Coalition in some ways, as the big goal of this grant includes working closely with school districts to promote best practices in education and punitive action. We really like a program called Second Chance as an alternative to out-of-school suspension when a student's caught with vaping products or other types of tobacco. Our coordinator also serves on the Tobacco Review Committee and is working on standardizing safe hazardous waste disposal, not just in schools, but also with businesses in the community. And as you might imagine, we're also dedicated to promoting the Colorado Quit Line and other cessation resources for those working to stop tobacco use. Next slide, on to suicide prevention. This map is from the CDC in 2020 and reflects the national population adjusted rates of suicide. Consistently, Colorado ranks in the top 10 highest rates of death by suicide. This is not something we love to see. Next up, in 2017, La Plata County specifically spiked in rates of suicide, which you can see on this graph. This flagged our county as a priority for targeted pilot projects addressing deaths by suicide. The La Plata County Suicide Prevention Collaborative is a little bit like the Roar Coalition, as it's made up of community members who are really working to improve local mental health outcomes. The approach is a little bit different for our Suicide Prevention Collaborative, though. If you go to the next slide, the La Plata County Suicide Prevention Collaborative is part of a national pilot project that began in 2020. And our county had been invited to group projects into 6 categories and coordinate these efforts in order to make a meaningful reduction in rates of suicide by 2024, which, if you're looking at a calendar, is next year. We have reason to believe that work in connectedness, economic stability and supports, education and awareness, access to safe care surrounding suicidal ideation, lethal means safety, and responding to deaths by suicide in your community and in the form of postvention and bereavement resources. All those efforts will have a meaningful reduction in rates of suicide and suicidal ideation. And this is a really big effort, just like with substance use prevention. It's not really the explicit place of public health professionals to do all of this work, but it is our role to make sure it's happening and that the right partners are working with each other in order to effectively serve our communities. If you have any questions, please just reach out. We'd love to have you as part of like the community efforts that make a difference.
Good afternoon,
Thank you.
everyone. My name is Francilia, and I'm going to try to be as brief as possible because our time is up. So again, my name is Francilia, and I am the outreach coordinator for the breast cancer prevention and early detection, or just CPED program. So early detection, next slide, I think. Yeah. So early detection is the key to breast and cervical cancer, and most cases of cervical cancer, they can be easily treated. Next. I put special attention on the Spanish speaker community because they are the ones that are low income and the majority are uninsured, and the ones who do not benefit for unemployment or any government benefit. There are general recommendations guidelines for PAP and mammograms. However, every case is different, and the primary care provider will be the one to assess how often the patient should have a PAP or mammograms. For instance, if a PAP comes up abnormal, the primary care provider might recommend the patient to have a PAP every year, and if not, 3 to 5 years. And that also applies to mammograms. If there is a history of breast cancer in the family, such as mother, sister, or mother, the primary care provider might recommend mammograms before age 40. And if that's not the case, 2 to 3 years after age 40 and annually after age 50. Next. To overcome some barriers, our program offers gas card, taxi vouchers, and to help the patient to get to and from the appointments. And I can also mediate when it comes to scheduling appointments or reminders. And some situations, still there are some barriers. And I am also connected with organizations in the community, such as Four Corners Immigrant Resource Center, Los Compañeros Family Center, Housing Solutions, Women Resource Center, and together we hold hands to support, the members of the community to overcome some barriers. Next. So to qualify for the program, as it was mentioned before, you do not need to be legally present, but have to have an income as shows in the slide. And if you know everyone that might qualify for the submitting program, here's my contact information. So sorry for being so brief, but we're out of time. So feel free to contact me or send out my information to whoever needs my assistance. Thank you so very much.
Thank you, Francilia. And we actually did schedule a little extra time today. So if anyone has any questions that you have not shared yet, we do have time to address those. We did have one question come in that was answered in the Q&A, but I wanted to go ahead and ask that live so that if there's anyone else wondering the same thing, they can have that information as well. So this is for Tiffany Roberts with the oral health program. And the question was, what counties does the teleoral health program serve?
Yeah, that's a great question. Thanks so much for calling that out, Katie. So again, it is a pilot, so we will be rolling it out in phases. We're going to start internally with clients who are already accessing some of the amazing programs we heard from today and start to roll that out. Once it's in its full iteration and out in the community, we will serve all 5 counties. So La Plata, Archuleta, Montezuma, Dolores, and San Juan counties.
Great, thank you so much for that extra information. All right. Anne, have you seen any more questions come in?
I have not.
Okay, great. Well, unless we have any more questions, we will let everybody go. I hope everyone enjoys the rest of their day. And we will have a recording of today's webinar that can be shared. So if you are interested in sharing the webinar with a coworker or anyone else, please feel free to reach out and we can get you a copy of that. And be sure to download the contacts and the slides from the chat before you disconnect from today. I hope everyone has a good day and a great weekend.